This is a podcast from the South China Morning Post.
We need to be clear. We're basically at a pandemic now.
So maybe you've heard about the coronavirus. It's a fast-spreading virus that originated in China and unfortunately is proving deadly.
The coronavirus crisis continues to worsen in China in the meantime.
The Chinese whistleblower doctor who told the world about the coronavirus in Wuhan has died.
A third case of coronavirus has been identified in the UK. Health officials
and that may be the first indication of what is called community transmission. That is the virus passing from one person to another here in Hong Kong.
Last week, we started our podcast telling you about the scene inside the offices of the South China Morning Post here in Hong Kong. Just as we were recording that, an email has been sent out to all staff. It asks us to stay away from the office, to work from home for 2 weeks as part of the voluntary quarantine. It's what the civil service, universities, and many other companies across the city of Hong Kong are engaging in to try and stop the spread of the coronavirus. Welcome to another special edition of the Inside China podcast. My name is Mimi Lau, and I'm speaking to you from a lounge room of one of my colleagues here on Hong Kong Island. You might hear some trucks and buses passing by. Our newsroom is now connected online and distributed across kitchens, bedrooms, and lounge rooms, while our core team stay on in the office to make sure the newspaper is printed. With me is Laurie Chen, my colleague from the China desk.
Today, as we speak to you, Hong Kong has closed most of its borders with mainland China. Most flights into mainland China are being cancelled, and now flights into Hong Kong are being cancelled as well. And the list of countries banning entry to all people who have been in mainland China for the past 14 days is growing. Singapore, Indonesia, Australia, the USA. A cruise ship which picked up passengers in Hong Kong was refused permission to dock in the Philippines. Macau has closed all of its giant casinos, and the World Health Organization has declared a global emergency. Why are we so scared? What's feeding this panic? Last year, 19 million Americans were infected with the flu. 34,000 died from it. The outbreak of the H1N1 flu in 2009 infected 762 million. But this is different. Every day we're hearing of new infections in different countries. Is it the fear of the unknown? A virus that has crossed over from the animal world into humans, that has now adapted to become transmissible from human to human? Are we right to be worried, or are we experiencing anxiety amplified by the constant feed of news and rumour via our phones? More importantly, what's being done about this coronavirus? How long will this go on? And what are we as a society, a global society connected by international flight, social media, and 24-hour global news channels, learning from all of this? Because this is not the first, nor will it be the last time we will be faced with this kind of emergency. And Hong Kong has a long history when it comes to dealing with virus outbreaks.
Just like last week, if you want the latest news update, the latest information, then go online to SCMP.com for ongoing 24-hour coverage. On this podcast, you're going to hear from people in mainland China.
The whole city is locked down, and now outside of every residential blocks, there are people from the government standing outside.
You're going to hear from people watching the impact in North America.
But if you go to, broadly speaking, non-ethnically Chinese residential areas, places that are sort of more traditionally white, for instance, face masks are very, very, very uncommon, and you don't see the same level of concern that you do in ethnically Chinese places.
And you're going to hear from people right here in Hong Kong about what's being done and what we can expect in the near future.
That the epidemic would reach its peak in around April if there was any reduction in the transmissibility of the virus.
And Laurie has been following something else. A secondary infection we are witnessing worldwide.
Yes, indeed, of racism and xenophobia directed at people from the Asian diaspora around the West. Obviously, this doesn't just affect Chinese people, but people who are Asian-looking. Obviously, Chinese people, they take up a huge proportion of the global travel market every year. There are hundreds of millions of Chinese international students studying in places like the US, the UK, and Australia. This is what it means when we say Hong Kong has history in dealing with global outbreaks.
Hong Kong flu. Hong Kong flu.
1968, a version of the influenza A virus spread worldwide from Hong Kong, killing over 1 million people. It was a team at the Queen Mary Hospital, not far from where I'm talking to you right now, who first isolated it, allowing a vaccine to be developed. In 2003, we witnessed the first coronavirus, known as SARS. It swept the world, infecting 8,000 people and killing 800. 299 of those who died were here in Hong Kong. SARS was what inspired the World Health Organization to introduce what is known as a public health emergency of international concern, a global alert. But SARS was also what led to a huge response in Hong Kong from the medical community, as well as ordinary everyday people whose habits and hygiene changed permanently. And you're going to hear how that experience affects how Hong Kongers around the world are reacting right now.
But first, to Wuhan. Last week, I told you about a nurse I contacted in Wuhan who had shared a shocking video filmed inside a hospital there, showing dead bodies wrapped in linen and her story of being denied medical care. In the past few days, the South China Morning Post has been contacted by another person in Wuhan. He too had shot video of what is happening now in the city and shared his story of desperately trying to get a diagnosis for his mother, his father, and himself. We have changed his voice to protect his identity, and this is some of what he had to say.
The government claims the Hunan seafood market is the epicenter, but none of us have been there. It started with no signs of human-to-human transmission, and we can avoid and control the outbreak, to putting the city under a lockdown on January 23. It's near the Lunar New Year. It's a time for annual parties, and the virus has been spreading as people gather. On January 23, Wuhan was locked down and public transportation was suspended. It's fine for families that have cars, but for those who don't own vehicles, they can only walk to hospitals. Can you imagine that? The elderly can only walk to hospitals. For people who live far away, they need to walk 2, 3 or 4 kilometers or even further. They can't suppress things anymore. There must be something wrong with the statistics they collect, because I found the hospitals did not have enough kits to test for the virus. Many people can't be hospitalized because they can't get a proper diagnosis. My symptoms are fine and I feel better now. I'm not worried about myself, I'm worried about my parents. If they can't be cured, what can I do? I can do nothing. There are too many severely ill people who still can't be hospitalized, or entire families that have been infected. I feel desperate, really desperate.
The latest report we have is that the number being counted of those infected and those who have died in Wuhan are just the tip of the iceberg. But there are many people who were in Wuhan who left before the lockdown. One of those who managed to get out before the city was quarantined is Echo Xie, a reporter here for the South China Morning Post. She's in a village in China right now, in quarantine. All across mainland China, people are in quarantine, either imposed by the government or imposed by themselves. And they are glued to their phones and laptops, both for entertainment and news of the outside world. Echo, thank you so much for being here with us. So can you start by telling us what is it like to be reporting on the front line in Wuhan?
So I went to Wuhan on January the 20th. It's the same day when Zhong Nanshan, the respiratory expert, went to Wuhan and he confirmed that there's a human-to-human transmission of the virus. I went there and I realized not all of the people treated seriously in the city. Because when I went to the subways, to the railway stations and shopping malls, I saw so many people still didn't wear masks on January the 20th and 21st. So when I asked people why they didn't wear masks, and they said it's not that serious. And they said if I were destined to be infected, it's useless for me to wear anything. But the situation in hospitals was different. When I went there, I felt a lot of people were exhausted because of the shortages of the medical facilities in the hospital, because people who had a fever of 39 or even 40 and had infections in their lungs, and I felt it's also a high risk of cross contamination, both in the fever wards and also just from their home to the hospitals.
So what you described just then is a huge contrast from the scene outside the hospital and inside the hospital, a contrast of lack of awareness within the city. And that's right before the lockdown, right? What happened after the lockdown?
So I just left 3 hours before the lockdown of the city. When I tried to leave the city, I saw many people went to the railway station to escape.
And we heard you have to be quarantined after leaving the city, right? Can you tell us a bit about that?
Sure. So I quarantined myself from the first day when I left to Wuhan. And for the first 10 or 11 days, I lived in a hotel in my hometown. And every day, my parents delivered me food 3 times a day. And it was quite boring because I don't have anyone to talk to and I cannot leave the room. So basically, I locked myself in a small room for 10 or 11 days. And I had a low fever on the 3rd day when I came back from Wuhan. I didn't know the reason, but later I was told by doctors that it might be a cold. But I was too nervous that night. It was the first day of the Chinese New Year when I found out that I had a fever. It's 37.3, and I couldn't fall asleep that night because I thought about a lot of things, like memories flooded my mind about the scenes I saw in the hospitals and the people I talked to and the symptoms they had. And I was wondering if I were the next person to be infected. So when I woke up the next morning, my temperature was even higher. It went to 37.5, 37.6. And then at that time, I realized I couldn't just live in the hotel and do nothing. So I tested 2 doctors in Beijing and another doctor in Canada, emailed him, and all of them suggest me to take it easy. The doctors in Beijing also suggested me to take some pills on cold.
Echo, can you tell me, when you were sitting in that hotel room all by yourself, isolated, experiencing that fever, what was going on in your mind? Can you tell us a bit about that?
I was very worried. And I thought, how about my parents? Because if I were transmitted to the hospitals or to the isolation places in my hometown, then how could they take care of me? Because they were older and they were more easily to be infected than I am. It was a hard time, and I didn't sleep that night.
So since then, you've been quarantined like many other people in China. Can you run us by what your daily routine is like?
So every day I wake up around 8 a.m. Then my parents would deliver me some food, and I can finish it around like 9 a.m. Then I wash my hands regularly. Like, I can't remember how many times I wash my hands every day. And besides, I will do some exercise in the room, and sometimes chat online with my friends, and also reply emails, because some of people send emails to me, like checking every day. So yeah, that's my daily routine.
This is the last day of your quarantine. What is that one thing that you most looking forward to do after getting out of this?
I still can't do anything, even though I finished my quarantine, because the whole city is locked down, and now outside of every residential blocks, there are people from the government standing outside with a table, several chairs, and the people are limited to go out from the residential compounds. So even though I finished my quarantine, I still cannot go out. I still need to stay at home.
Laurie, last week you told us about the evolving misinformation and conspiracy theories that are swirling on social media, both inside China and on Facebook and Twitter. So what has changed the past week?
Since last week, Facebook and Twitter introduced new policies specifically combating misinformation surrounding the coronavirus, and Facebook in particular cracked down on so-called cures against the coronavirus in particular. I think I've noticed a bit less this week, but China has not come out to disprove or deny some of these rumors, especially surrounding cures and also the sort of Western rumor of the Wuhan virus being the sort of, bioweapon. So China hasn't come out to specifically deny these rumors, but actually Chinese state media, I've noticed, they have spread some rumors. So a few days ago, Xinhua, the official state news agency, they promoted a traditional Chinese medicine cure called shuanghuanglian as something that will inhibit or suppress the symptoms of coronavirus. And embarrassingly, one day later, they had to come out and deny that. According to the WHO guidelines, no drug or treatment is currently effective in treating or curing the coronavirus.
So Laurie, what's your sense of the general public reaction?
Well, I think people are skeptical. But even though Xinhua came out with the shuanghuanglian cure last week, people still rush to pharmacies around the country and they bought up stocks of all of that kind of medicine, which is just a common cold medicine, really. It has no effect. But yes, I think there is still a lot of public outrage on social media, but the government are obviously controlling the narrative on platforms like Weibo and WeChat. I've noticed state media trying to direct public anger, not towards certain the government or officials, but towards, people who are being named or shamed for trying to hide their symptoms or run away from Wuhan or trying to supposedly intentionally spread the coronavirus. Yeah, it is just a sort of blame game. They're shifting the blame from target to target.
But how effective is that?
Not really. I think people still ultimately know that the responsibility and the accountability lies with the government. But the government are just trying so hard to control the narrative and track down on misinformation that actually it's helping to foster the spread of misinformation on the Chinese internet.
Talking about a blame game, you're also following the development in US and Europe, right?
Yes. So in the US in particular, there's a long history of exclusionary immigration policies targeting Chinese immigrants from, over a century ago, really. And I've spoken with a few Asian American studies professors who are saying that, the current sort of fear and panic around the spread of coronavirus being carried by this race of people is actually tapping into these sort of latent anti-Asian, anti-Chinese sentiments that are kind of rearing their heads again, even in this sort of politically correct and woke age. And in Europe as well, obviously there have been long-standing fears about immigration, and obviously Europe is a top tourist destination and study destination for Chinese people as well. And they're certainly very worried there from what I can gather from talking to people. Here in Hong Kong, the tension is rising. This morning, more than 10,000 people formed a queue, waiting for a new shipment of masks to be offered for sale. Hong Kong's chief executive, Carrie Lam, has stirred huge controversy by first appearing at a press conference wearing a mask, before she backtracked a few days later and ordered officials not to wear masks. She even told them to take them off when already wearing them to save stocks for medical workers. The issue over masks in Hong Kong runs very deep, and for very good reason. It goes back to 2003 and SARS, when Hong Kongers had their first experience of life under the threat of a coronavirus.
We would come home and we'd stand in the doorway of our apartment and we'd take off our N95 face masks. We'd drop them in the bin next to the door, a pedal bin. We'd strip off unromantically and chuck our clothes into our washing machine with a big cap full of Dettol, and then we'd shower immediately.
This is Ian Young. He's a senior journalist working for the South China Morning Post, based in Vancouver. 17 years ago, this was his experience in Hong Kong during SARS.
My wife was a frontline reporter for the South China Morning Post, and she was visiting infection sites, places like Amoy Gardens, where we had hundreds of people falling ill. In fact, that was the most infected place in the world, and we had dozens of people dropping dead. So this was a very, very serious matter, and we took it very, very seriously. And when we see people wearing masks over here in Vancouver, amongst the Chinese community, we don't think that's very fun. We don't think that's a joke. We don't think that's funny because we lived through SARS, and we know that it's nothing to find amusing.
What Ian and his wife lived through and reported on as journalists is instrumental in understanding how Hong Kongers are dealing with the news of the coronavirus.
For people from Hong Kong who were in Hong Kong at the time of SARS, there's nothing particularly unusual about wearing face masks. And so when we see the current concerns about the novel coronavirus, that reawakens all of those memories, all those collective fears, and also all of those group behaviours that were prevalent at the time of SARS in 2003, when face masks were not just commonplace, they were everywhere. Everyone wore face masks pretty much all the time outside, and you're seeing that again in Hong Kong.
He's also witnessing the collision of cultural attitudes in Vancouver between the Hong Kong diaspora and their fellow Canadians.
Yeah, there's always sort of been this cultural disconnect here between broadly speaking, the East Asian communities and the Hong Kong and mainland Chinese and Taiwanese communities, and, the non-East Asian communities here in Vancouver. And, Vancouver's it's a wonderful multicultural place, but there is still quite a disconnect. If you go down to Richmond, which is the most Chinese city in the world, outside Asia rather, this is a satellite city of Vancouver. It's part of Metro Vancouver. You go down there and face masks are very, very common. That city is more than 50% ethnically Chinese, and parts of it are about 80% ethnically Chinese. So face masks are very, very common, not just normal surgical face masks either. I was down there on the weekend and saw quite a few people wearing those hardcore N95 respirator type masks. So it's taken very seriously there. But if you go to, broadly speaking, non-ethnically Chinese residential areas, places that are sort of more traditionally white, for instance, face masks are very, very, very uncommon, and you don't see the same level of concern that you do in ethnically Chinese places. And that's sort of manifested not just in mask wearing. We do see a certain level of, lightheartedness and almost ridicule from people outside those Asian communities. When they see people wearing masks, they do tend to see it as a little bit of overkill or paranoia or something a little bit ridiculous. And, I think that reflects the gap between the way this disease is being perceived.
In 2003, it took 5 months for mainland China to provide a gene sequence of the SARS virus to scientists around the world to develop tests and treatments. For this coronavirus, it took just 1 week. And now, scientists in Singapore, Australia, and the US have joined with scientists in Hong Kong and mainland China to stop the spread and stop the casualties. The lead reporter for the South China Morning Post covering these subjects is Elizabeth Cheung. I know you're extremely busy right now, so I'll keep this very, very brief. Has this outbreak peaked? What are the experts are telling you?
So, Professor Yuen Kwok Yong, a top infectious diseases expert from the University of Hong Kong, actually last week he said that actually we still haven't reached the peak of the epidemic yet. And Professor Gabriel Leung, the Dean of the HKU Medical School, he actually earlier suggested that the epidemic would reach its peak in around April if there was no any reduction in the transmissibility of the virus. So I think we're still having 1 or 2 months to go to see before reaching the peak of the disease.
So that's their assessment over Hong Kong. Did they say anything about what's going on in China?
Well, actually, their estimation applies on mainland China. So I think when it's about mainland China, that was actually, on the other hand, also affects Hong Kong as well.
So the peak is coming in May and April?
In April, actually, according to the latest estimation, and some of the mega cities in China, such as Shenzhen, Chongqing, Beijing, that would be affected.
So, Elizabeth, can you tell us about how are these patients being diagnosed with coronavirus? What do you know about the drug regimen being prescribed to them?
So about the test, since the Chinese scientists, they have shared the genetic map of the virus, scientists in different places, they have been developing rapid tests in their own places. Just alone in Hong Kong, first of all, we have the Department of Health. They were providing a test. And since the start of this month, public hospitals under the hospital authority have also been providing their own rapid tests. And this could actually speed up the diagnosis of cases. And when we're talking about treatment, actually now doctors, they are using drugs that were used to treat SARS, MERS, and HIV to treat these patients infected with the coronavirus, because now we do not have specific drugs for this coronavirus. Well, actually, a US biotech company is actually partnering with Chinese health authorities to test a drug that was originally designed for Ebola virus to see if it is fit to be used for the coronavirus treatment as well. So they are now still in the clinical stage, but maybe we'll see a new specific treatment very soon. Yeah, we don't know.
What is the latest on the development of vaccine for coronavirus?
Since we have the first imported case in Hong Kong, the team of scientists led by Professor Cheung in HKU, they were working actually pretty hard to develop a vaccine. And actually last week, Professor Yun said that they have already developed a vaccine in Hong Kong. And why they were able to do that was because they were able to isolate the coronavirus from the first imported case in Hong Kong. The vaccine they were developing actually was based on a nasal spray flu vaccine that was previously developed by Professor Yun. So they kind of modified that vaccine with part of the surface antigen of the coronavirus. And that means that, to put things in a simpler way, if the vaccine is successful at the end, it will be able to prevent both flu and the coronavirus. So now they already have this product out, but they still need months to test on several types of animals, as well as another year, at least for another year, on humans during the clinical trial. So now we don't have a specific timeline on when will this HKU vaccine will be available for use, but meanwhile, scientists in the mainland, in the US, in Australia, they were all racing against time to develop vaccines so as to, prevent infections of this deadly virus.
Elizabeth, thank you so much for your time. I know you got a press conference to cover, but we look forward to get you on the mic soon.
My pleasure, thank you.
That's all we have for you in this latest edition of the Inside China podcast. Don't forget to check online at scmp.com for the latest news updates in our 24-hour coverage of the coronavirus. And don't forget our other podcasts being produced here in Hong Kong. Search for the US-China Trade War Update for a weekly update on how the coronavirus is affecting China and global supply chains. And for the best insight about technology, search for Inside China Tech. Stay safe, stay healthy, and thanks for listening.